we come to the heart failure. Did you read it? Now, let's read it together. ايه ولا لا ولا بدكم تسألون شو بدكم؟
لا نقرأ
Now,
اقرأوا comment.
63 years old man who presents to the outpatient clinic. He has been treated for 2 myocardial infarction, hypertension, non-insulin dependent diabetes, stasis dermatitis of the left leg. He had an aortocoronary bypass surgery 1 year ago. Now, the doctor asked the patient, what is your complaint? I told you what's the meaning of complaint, yes? You know what's complaint? Good. Now the patient answered, shortness of breath, progressive over the past 5 days. شنو معناها؟ Progressive shortness of breath.
Fluid is accumulated in the lung.
شو shortness of breath؟
dyspnea.
قلنا بالهارت فيلر يصير dyspnea بالليفت ventricular failure. Shortness of breath هي dyspnea. So the patient complained of shortness of breath progressively. معناها
Increase.
أسوأ. It goes from worse to worse. Now, and also هذا المريض يحكي. The patient is talking. And also I experienced episodes of shortness of breath during the past 4 months. Especially when exerted. شو الفرق بين أول والثاني؟ أول واحد قال shortness of breath progressive over the past 5 days. الثاني قال I experienced episode of shortness of breath during the past 4 months. Especially when exerted. شو الفرق بين 5 days وبين 4 months؟
5 days acute.
In 5 days, significant increase, progressive increase. I was complaining for 4 months. I was complaining of dyspnea, but mainly on exertion. When I'm exerted. So during last 4 months, I was complaining of dyspnea, particularly with the exertion, as I told you, stage 1, stage 2, stage 3. And within the last 5 days is progressively decreased. Clear? بدون exercise. Without exercise, progressive increase now. خلينا نكمل. أنت ما قاري الكتاب الورقة دي. Now, the patient asks again, do you have any other complaint? Is there any other problem? The patient answered, I fatigue easily and lost all my energy to do anything. I also complain of anorexia. You know anorexia? Loss of appetite, not interesting to eat. Last night, I awake suddenly from sleep because I couldn't catch my breath and developed a dry cough. The breathing problem improved when I'm sitting. On the edge of the bed for an hour. I generally sleep with 2, sometimes 3 pillows. I had no experience chest pain or leg pain. شوف ده شو المريض عندك؟ ليش؟ قبلها ما في ده
No experience of previous chest pain.
اي شو سمينا؟ dyspnea. بعد الديسنيا قلنا 2 pillows و 3 pillows. Orthopenia, which is related to position. I told you that sometimes the patient put 2 or 3 pillows, and you assess the severity from how many pillows he put. So he has orthopenia plus the paroxysmal nocturnal. He sat on the bed for 1 hour, then I'm feeling better. So the patient now complaining of dyspnea, shortness of breath. mainly on exertion. Then this is progressively increased. Then the patient complained because of the orthopnea, because he is putting more than 2 pillows. And sometimes he wake up during the night, sitting on bed for some time, then he's feeling better. So that's what's meaning to you. Left ventricular failure.
Ventricular failure.
That is from the history, from the patient complaint. Clear? في حد بده يسأل؟ Now, examination. I had not experienced chest pain or leg pain. ما عندي no chest pain and no leg pain. Main problem here, dyspnea. Now examination. فحصنا المريض. In the clinic, reveal unnourished man who appeared depressed and older than his stated age. He is unkempt and unshaven. His breathing is labored and his lips have a blue tint. شفت هذا؟ فحصناه. هذا أول ما شفناه بعد ما خلينا إيدينا ما سوينا شيء. Just looking at him. You have clinical findings. It can be sign شو بتشوف. What you are seeing. Symptoms, patient complaint. Then clinical examination. Now when we are looking, when we saw the patient, this one, he is unnourishment. There is no good nourishment. ما في food. No good food. Or because he is depressed. And he lost the appetite. Anorexia. So, unnourished, depressed, and older than his age. يعني هو 63, looks to be more than that. He is not interesting. Depressed people, they don't interesting in their shape, clothes, or behavior, and also they don't care about shaving or not. This is because of depression. You will take that in the 5th year. Psychiatry. His breathing is labored and his lip, because of shortness of breath. Now, cyanosis in the lips. Will the breathing, because of dyspnea, to overcome that or to compensate for it, increasing the breathing. Shallow. Normally, we have about 12 breaths per minute. It can be 20, 25 according to the severity. So this is when we looked at the patient. Now, examination. Now, examination of the lungs reveal dullness or to percussion in both bases with a decreased excursion of the diaphragm, coarse bronchi, moist, inspiratory crack, and here bilateral on the 2 lungs. Now, when you do percussion, it means what? You put your finger or your hand on the chest, in between, in the intercostal spaces, and then you knock on that. If there is an air, then panic. Okay? If there is no air or fluid, it's dull. So this is in here, يقول في dull. معناه area, some area, there is no air. There is some sort of fluid. So dull, it means when you percussion, that means you, I don't know what to do with, you call it. You percussion, you put your fingers and then hit your fingers and then you will hear sound. The other thing هو cracking. From the sound, when you take breathing, imagine when you have an air and you put an air in a flow, air, blow some air in a bottle full of water. شو بيصير؟ Bubbling. مش بيصير صوت؟ That is the same thing here because of the accumulation of some fluid in the lungs. When the Patient take the inspiration, it makes some sort of bubbling, which is called the crepitation, crack. That will produce sound. If it is severe, we can hear it without putting the stethoscope. Sometimes, if it is not severe, when we put the stethoscope, we hear it. That's why we take this breathing while the patient in supine position, and then we put the patient in sitting position, and we listen also. Clear? Now, that is for the
دكتور بس في الفيتال ساينز
هي هسه لا واحده واحده
بس لا انت حبيت
هسه الفيتال ساينز.
اوكي.
Blood pressure 98 by 82 in the right arm. Heart rate 110. Respiratory rate 26. Normally 12. Course of bronchi, that. Respiratory rate and temperature 98. So in here, the blood pressure is low, simply because heart failure, contractility, because ejection fraction is less. And now, the blood pressure, why he put on the right arm? في فرق بين الرايت والليفت؟
Sometimes.
Yes.
حسب وين الفيلر.
Yes. If you measure the blood pressure normally, on the right and on the left.
نفس الشيء.
Yes.
هذا different.
both same level.
Yes, both same level, yes. But sometimes there is some difference.
اللفت اقرب.
لانك تستخدم الرايت اكثر مرة.
You remember the origin and course of the left and the right brachial artery? When في some sort of angulation, the right side. So it can be sometime 4 or 5 millimeter mercury difference. But this is acceptable because of the, if you go and follow the course of the direction of the left and the right brachial artery. Now, examination of the lungs. حكينا عليها. والفيتال الفيتال ساينس قبل
كان قصدي.
Now, في حد عنده سؤال لحد الهون؟ Now, examination of cardiovascular system. Neck vein are prominent and distended to the mandible when the patient is sitting upright. So what's that mean? Jugular veins are pulsating and dilating. I should be. So the right side. So now in addition to the left, now we have the right. Let us see what are the other findings in the right. Now, SE3 is palpable at the apex. S1 and S2 are diminished. SE3 is here at the apex. Grade 3 by 6 hollow systolic murmur is here, based at the apex, radiated to the left axis. What's that mean? You know, normally we have S1 and S2. Check, labda. Sometimes we have in the young age, like you, third heart sound. Not always we can hear it because the decimal level, strength of it is very low. This is because of what developed, rush of the flow of the filling. You remember we said the first part of the filling. The first part, which is passed from atria to the ventricles by pressure difference. This is the fast filling. This rush of it makes sort of turbulent flow to the septum, to the papillary muscle, and it can cause sound. This is called third heart sound. This is normally, in young people, this is physiological third heart sound. In old people, third heart sound is an indication of heart failure. If you hear it in the old age patient, old age people, this is an indication of heart failure. It's called gallop. Gallop, when you say labdab, you say labar, labar. That is exactly يسموها gallop. You know the horse when it's running? That is the gallop. Gallop breathing. This is mainly developed in the heart failure. So S3 in young people it's physiological. S3 in old patients
Heart failure.
it's a sort of gallop, which is a third heart sound, an indication of heart failure. The severity at the apex mainly, the severity it depends on the severity of heart failure. Now, unradiating systolic murmur now, it is again for the ejection. For the ejection of it will cause systolic murmur, and this murmur, it goes even to the axillary. You can hear it. It's called hollow. During hollow معناها all the systole. في سؤال؟ المرمر it is mainly for the flow. A turbulent flow. In here and in here. In the young people, it is for the old. In the old young age people, it is physiological. In the old people, it is heart failure. Now, examination of the abdomen. The anterior wall is round and soft. The liver edge is palpable and tender. Palpable معناها في hepatomegaly. Tender, it's painful. Because there is a significant stretch of the liver when you press on it. Tender, it's simple thing, or simply means when you touch anything and it's painful, it's tender. So tender, swelling, it's tender. Liver palpable, it's tender or not. When you have a fracture in the lip, it's tender or not. When you have a swelling in the leg, is it tender or not? Tender, that means what? When you touch it, it's painful touch. This is what's the meaning of tender. Examination of the extremity, the spleen is not palpable, so there is no splenomegaly. Examination of the extremities reveal diminished peripheral pulses. ليش? There is an irregular pulse and there is patent edema of both extremities. So why the pulse weak?
Increase.
It is the heart, but also in here. There is a patent edema. So there is an edema. So it's sort of pushing or compressing on the artery is not easy to feel the pulsation. Of course, weak pulsation because of the weak contractility also. So the patient hospitalized. Admit him to the hospital. Now, these are I don't know what they told you, the questions or will be included on investigations. That is the leukocytes, the white blood cells, hemoglobin, platelets, the chemistry, glucose, creatinine, bilirubin, protein, electrolytes, sodium, potassium, and so on. ما بعرف أنا شو قال لكم إسماعيل. These are included in the questions or not, I don't know.
No.
وين عمر؟
لا حكى لي لا ما راح يسأل
ما راح يسوي هذه.
بس إنه في questions بآخر
اي ما هو ابني الكويشنز هون ماركد chest x-ray سووا له أشعة chest x-ray marking the prominence of the pulmonary vascular shadow يعني pulmonary artery it's prominent. Bilateral pleural effusion, that means what? Fluid in the pleural cavity. That's why the dullness. Because when we put the fingers and press on it or hit, you don't feel tympanic sound. You feel there is a dullness. The dullness here because of the fluid. So there is a fluid in the both sides. اللي هي a pleural effusion it's called. And increase the haziness and decrease radiolucency and lung parenchyma bilateral, increasing the transverse diameter of the heart because CTR ratio increased. Now, the questions here, what are the types of heart failure? As I told you, right, left, acute, or chronic. I hope that they will not put the معرف هو قال لك راح يعطيك من الاسئله من وين يجيبها؟
كيسز
ها؟
كيسز
من هذا الحكي. مو اكو في افتر لو اكو افتر لود واكو لودنج اكو another classification of heart failure. But mainly these are because we are not talking with you are still at the beginning. ما اعتقد راح يجيب بالهذا. اوكي. بالمعلومات الموجوده بالكتاب. مثل ما حكيت لكم myocardial infarction, infection, valvular disease, arrhythmia, these are the
كوز
causes. والتايبس هي acute وكرونيك
رايت
وليفت ورايت وكونجستد. سو هذا المريض شو عنده؟
كونجستد
congested left and right. What are the signs and symptoms of heart failure? Dyspnea, orthopnea, PND, pulmonary edema, peripheral edema, dilated jugular veins, hepatomegaly, splenomegaly, some to the right, some to the left, some for both of them. Here, these are the types, causes, and signs and symptoms. How to diagnose the heart failure? The best one, echo.
ايكو
The best one will echo because that will give you the injection fraction. That will give you severity. Of course, you can assess the diagnosis from the sign and symptoms. When he is complaining dyspnea, orthopnea, PND, this is left side failure. Then we say dilated jugular veins, peripheral edema, hepatomegaly.
Right.
That is right. So both of them congested. Now that's easy from, now you diagnosed by just history and looking to the patient. Now we want to say the assessment, the severity, how severe it is. That is, it depends only on mainly
Ejection fraction.
on ejection fraction. Between 40 to 50, it's mild. Between 30 to 40, it's moderate. Between 20 to 30 is severe. Less than 20, which is rarely to see patients. You can see, but rarely. That is very severe. And those patients, you put them for cardiac transplant. يخلوهم على الويتنج list. And the last question هو treatment. management. بالأحرى ما في treatment. management. شو الفرق بين treatment و management? Treatment just you give medicine and management you manage
كنترول
sign and symptoms and in addition to the it is actually as I told you the worst type of disease هو heart failure because it depends on the again severity. It's not easy as most of the patients will be depressed and then they refuse to do anything, they refuse to eat because of the depression and even they refuse to take drugs. And according to the severity, as we said, whatever you are going to do to them, particularly even if it's moderate, they will not live more than 5 years. Most. But some patients, they live more than 10 years. It depends on how you handle them. هذا واحد من عندكم لا سمح الله طبيب أو ممرض and he follow the instruction and he follow them to his mother or father, he can save them for a longer period. Now, any other question? Yes.
Pitting edema, they usually write dependent. What does this mean?
Sorry?
Dependent pitting edema.
Dependent edema when they are sitting or standing. The fluid will go there. Depend on the position. Yes. Yes. لا. الهارت ريت ما له علاقة. هو supposed to be يعني حكوا لكم على الديجوكسين وهذا الشيء. فالهارت ريت ما بيزيد. هو إذا يزيد السمباثيك. But you see when the muscle is weak, you cannot increase it. I mean there is some damage. You cannot improve the damage. What's the idea of treatment is mainly to prevent the deterioration, to leave it where it is, to keep the complaint as it is, to prevent more to become more worse. As I told you, remember, في سؤال على الانترودكشن lecture اللي عطيتكم إياها
سؤال
في سؤال واحد. Always remember,
ايوه
treatment management, when we are doing everything, we don't necessarily prolong the life.
وامبروف
We are improving the quality of
اوف
life.
لايف هاي السؤال
When we do echo, when we do x-ray, when we give a treatment, it's not necessarily to prolong the life. The idea of handling the patient to improve his quality, to make his quality as his life as normal as possible, so that he can work, he can go to work, he can manage his normal life daily without depending on the others. And الإيكو اللي راودكم إياها المحاضرة هذه كان فيها من عدة سؤال. المصطلحات اللي الدوبلر ولا يعني اللي معقدة ما بجي.
خلص تمام
شو بدكم بعد؟ يعطيكم ألف حاجة. أعطيكم معاذ.